Pembrolizumab versus chemotherapy for cancer PD-L1 positive non-small cell lung cancer by Camila Moreira, 4th semester 8, teacher John Moscoso. Background. Pembrolizumab is a humanized monoclonal antibody against program that 1 or PD-1 that has anti-tumor activity in advanced non-small cell lung cancer or NSCLC with increased activity in tumors that express program that ligand 1 or PD-L1. Lung cancer is the most common cause of cancer death in both men and women worldwide. NSCLC represents between 80 and 85% of all the diagnosed lung cancer cases and is generally diagnosed at advanced stage. Lung cancer. Applications in medicine, pros and cons, issue of bionecker, conclusion, and my blur.
Lung cancer can start in the windpipe, the main airway, or the lungs. It develops when there is uncontrolled growth of abnormal cells inside one or both lungs. These cells grow to more than 8 out of 10 cases of lung cancer in the UK are caused by smoking. If you're a smoker, quitting is the best thing you can do for your health. Passive smoking also increases the risk. Lung cancer is more common in older people and in people with previous chest problems or lung diseases such as emphysema. Other risk factors include exposure to radon gas, air pollution, and chemicals in the workplace. A cancer that starts in the lung is called a primary lung cancer, while a cancer that starts in another part of the body and spreads to the lungs is called a
non-small cell lung cancer. What is non-small cell lung cancer, NSCLC? Most people who have lung cancer have NSCLC. Although it's serious, treatment can sometimes cure it or stop it from getting worse. There are things you can do to help you feel better, too. People who smoke or who breathe a lot of smoke are most likely to get NSCLC. Many of them are over 65. There are 3 kinds of NSCLC tumors. 1. Adenocarcinoma starts in cells in your air sacs that make mucus and other substances, often in the outer parts of your lungs. It's the most common kind of lung cancer among both smokers and non-smokers and people under 45. It often grows more slowly than other lung cancers. 2. Squamous cell epithermoid carcinoma starts in cells that line the inner airways of the lungs. About a quarter of lung cancers are this kind. 3. Large cell, undifferentiated carcinoma grows and spreads more quickly. That can make it tougher to treat. It's about 10% to 15% of lung cancers. Causes. Doctors aren't sure exactly what causes this disease. Many people who get it have smoked or been around smoke. Other things that make lung cancer more likely are radon, a radioactive gas found naturally in soil and rocks. Asbestos, mineral and metal dust.
The analysis. Patients were randomly assigned to receive treatment with either pembrolizumab administered IV at the dose of 200 mg every 2 weeks for 35 cycles or one of the following 5 platinum-based chemotherapy regimens for 4 to 6 cycles. Treatment was continued for the specified number of cycles or until the patient has radiology disease progression or had a treatment-related adverse event or unacceptable severity. Patient is in the chemotherapy group who has disease progression which has verified by means of blinded, independent, central radiologic review who crossed over to receive pembrolizumab if safety criteria were met. Patients in either treatment group who were in clinical stable condition or were considered by the investigator to be deriving clinical benefit could continue therapy after the disease progression. Applications in medicine.
three main treatments for lung cancer: surgery, radiotherapy, and chemotherapy. The treatment you need depends on what type of lung cancer you have, where the cancer is, and your general health. You may have an operation to remove the tumour and some surrounding tissue. This may mean the surgeon removes a section of your lung, a lobe, or the whole lung. It is suitable for some types of lung cancer that are at an early stage. Depends on your cancer. Each treatment lasts for a few minutes. Chemotherapy is the use of anti-cancer drugs to destroy cancer cells. Most drugs by injection or through a drip into your bloodstream, but some are tablets that you swallow.
Pros and cons. Treatment-related adverse events occur in 73.4% of the patients in Pembrolizumab group and in 90% of the patients in chemotherapy group. The most common treatment-related adverse events were diarrhea, fatigue, pyrexia in the Pembrolizumab group, and anemia, nausea, and fatigue in the chemotherapy group.
I had the privilege and the pleasure to present Keynote-24 here at the ESMO conference. And Keynote-24 has been a randomized trial investigating immune therapy and anti-PD-1 antibody pembrolizumab compared to platinum-based chemotherapy as first-line treatment in patients with advanced non-small cell lung cancer and high PD-L1 expression. The assumption was that pembrolizumab will be superior in efficacy to platinum-based chemotherapy. And this has been something that indeed we have seen in the Keynote-24 trial. So the primary endpoint has been progression-free survival, and we have seen a significant improvement in progression-free survival in favor of pembrolizumab, with a prolongation of the median progression-free survival from 6 months.
In Israel, in Ecuador, there is increasing progress in cancer treatment. One is immunotherapy and is considered as one of the cutting-edge procedures for which it received recognition of the scientific finding of 2013, according to the journal Science. Progress in this scientific branch is frequent. Only 1% of studies presented at the Congress of the American Society of Clinical Oncology were based on this technique 3 editions ago. The figure rose to 10% in the next, and were a quarter of those who spoke about immunotherapy in the last meeting, according to a report released by Diario El País. Conclusion. The result of this randomized trial showed the superiority of anti-PD-1 therapy over platinum-based combination chemotherapy as first-line treatment for advanced NSCLC with PD-L1 expression on at least 50% of the tumor cells. First-line treatment with pembrolizumab resulted in significantly longer progression-free and overall survival than did the standard chemotherapy. The magnitude of benefit observed in the chemotherapy group is consistent with that previously observed with platinum-based combination regimens and penetrance maintenance therapy. Pembrolizumab was associated with significantly longer overall survival than was chemotherapy, despite the low number of deaths observed and the potentially confounding effect of crossover from the chemotherapy group to the pembrolizumab group. And the bibliography.